Dr. Tarver has asked that I show a film clip for you. This is a video that was filmed from a long-term care nursing, certified nursing assistant, and we'll hear in her words about today's topic.
I'm a 62-year-old African-American female. I'm a grandma, five of five. I have a son, I have a daughter. I've been here at Holly Heights for 13 years. I love working here. The years should tell you that. Well, my concerns were, of course, allergic reactions, and not just allergic reactions, but what will it do to me, And those are the initial concerns of anybody that's human, and especially with a new vaccine, you just don't know. So those were my initial concerns. Well, I had visited my mom one day, and she was talking about how she was going to get the vaccine. And my sister lives with her, and my sister has lupus, and she's going to get the vaccine. And my mom is a diabetic, and she's almost 80. And they were just so confident about it that it just made me think, well, they got more problems than you got physically. So what is your problem? So they really did boost my confidence level as far as getting the vaccine. And I think they should be more worried than anybody, but they're the ones that changed my mind, really. I'm not going around making speeches or anything. They see that there are no worries on my part. And I talk about it really positive. Like, we work in the healthcare field, and this is not going to go away. We have to set the pace for people, And I have a coworker last week. He definitely told me he wasn't doing it. But today he came and said, I'm doing it because of you, Sharon, because you made me feel, not worried about getting the vaccine, And that really made me feel good. I mean, I'm not going out here, like I said, to make speeches, but obviously I'm doing something right, because it's been several people that have heard me talk, and they're like, okay, well, we're going to do it, So that makes me feel great, especially when I'm not trying to change anybody's mind. I have a supervisor that works on nights, and then another co-worker. They were talking to a group of ladies that are still hesitant about taking the vaccine. They had more scientific stuff to say about the vaccine that I didn't know. And they made me listen to them because they were more thorough in what this vaccine is about. I don't know all the scientific stuff about it, but what they had to say did make some people stop and listen. I don't know if it changed their mind, but it did make them listen to about what they were saying. Because we hear stuff on the news all the time, but a lot of that stuff we're not sure of, but they went into a lot of detail about the vaccine. But as far as convincing other CNAs on getting the vaccine, everybody's got their own opinion about it, and I think the respect level that they have for me, I think that's has changed some people's minds, about how long I've been here, and everybody's comfortable with me. And to be honest, I don't know if it's what I said. I just think it's the way I said it. That there were no worries in my voice. There was no, well, I don't know, but I'm going to get it because, my mom's going to get it. My sister's going to get it. I didn't say it like that. I just said they gave me a confidence level that this vaccine should be done. And one of the social services girls, she just said, well, if you're going to get it, I'm going to get it. We have to set the pace, especially in the healthcare field. We are exposing ourselves every day to this a virus. And like I said, I don't want to expose anybody to what I work with every day. It would make me more comfortable just being around my grandkids, knowing that I'm protected.
Okay, I'll turn it over to Dr. Tarver.
All right. Good morning, everybody, or good afternoon. It's good to have so many of you listening in. I see 86 participants, so I'm happy to see so many people. I can only see a few of you while I talk. So hopefully if something's going wrong, Kathy or Denise will let me know. But I wanted to start with that video because I think it makes a couple of really good points, and I really appreciated Sharon's vulnerability and her honesty when she's talking about the vaccine, because I think she represents a lot of important points and important voices that we need to think about. One thing that I like that she said was, I'm not going around making speeches about this. Well, I am. I'm going around making speeches about the vaccine, but I'm limited in my scope of who I can influence, right? Some of you know me personally, and you may very much trust what I say, what I think. Some of you may not know me at all, and you're curious and want to listen in. People make their minds up about things like this vaccine more based on their relationships, their trust relationships that they have with other people, more often than they do on just information alone. Information helps a lot, but those trusted people around you, especially those who you trust with scientific or medical information, those opinions probably weigh more than anything I can do here today. And so what I'm hoping is that if you are someone who is willing or maybe who already has taken the vaccine, that you'll consider yourself to be somewhat of an ambassador, and that you'll have a little bit more information so that when people bring up questions, you've thought about some of those questions, some of those common things that people worry about. So I'm hoping that we'll get through some of those today. We're going to do it Mythbusters style. I don't know how many of you have watched a Mythbusters TV show, but so I'll throw up a few statements, and then we'll address the truth or lack of truth that's in those statements. So what I want you to do is try to guess on the front end whether that's a myth or whether it's true before I go on and talk about it. So let's get started. So statement number one, most people have serious concerns about vaccination. True or false? And you're welcome to chat your responses in. So I want to go through a study that was done at the University of Michigan. Someone unmuted. There's a study that was done at the University of Michigan where a national poll on healthy aging was taken. And this was from November, so it's a few months old. I'm gonna give you a second to mute, Denise. So in this study, we saw what we typically see. Okay, can you hear me now? Sorry about that. We muted me. So in this study out of the University of Michigan, it was a poll that was done nationally on people's ideas and feelings about the vaccine. And this is from November, but I would say that it's probably not a whole lot different now than it was in November, because the vaccine is still new in most people's minds. So at that time, 20% of people said, yes, give it to me as soon as possible. I can't wait to get it. 46% of people said, I'd like to get it, but I'm gonna hold back and wait and see what happens after a few other people. I'm not gonna be on the front curve of people getting it. That's most people who feel that way. And then 20% of people said, I'm not so sure. And then there were 14% of people at that time that said, no way, not doing it. And so this first statement is true. Most people do have some serious concerns about this vaccine, and there's nothing wrong with that. That's how we all approach something new. I think it's wise to have concerns about anything new that we're thinking about, especially something that we're going to inject into our bodies, right? And so even though I probably land in that 20% of people who are sort of early adopters, some of that has to do with the degree to which I've seen COVID play out. You know, those of us who are healthcare providers and we see what COVID can really do up close and personal, that changes things a little bit for me, right? And that makes me say, ugh, you know, this bug is really bad, and it's doing things that I've never seen before in my career, and lots of people are dying. And so that's probably one of the reasons why I would be an early adopter, somebody who I was, running, couldn't wait to get the vaccine in my body. Okay. So what about this? The rush to get these vaccines approved makes them less safe. I think that's probably one of the most common concerns that I hear. One thing that I want you to know is that the FDA is using the exact same standards that it has used for decades in regards to the safety and efficacy trials for this vaccine. They didn't change anything as far as that goes. They didn't loosen any of those safety standards. They're using exactly the same safety standards that they always use. No steps have been skipped in the development of the vaccine. That's something that people think a lot is, well, they must have skipped over something. How they do this quickly? Well, I'll tell you how we did it this quickly, or how it was done this quickly. One is lots of money and lots of research effort were thrown at this one issue very, very quickly. And that's not been the case for anything else that I can think of in my career. Even when AIDS came around, money was slower to come in and research was slower to come in, and so we didn't see advances in fighting that virus as quickly as we have with the coronavirus, because it affects every person on the earth, right? Potentially. And so that degree of intense study and intense research is really what has allowed the vaccine to be developed quickly. The other thing that I want you to know is that a lot of the technology or the science that was involved in creating this mRNA type of vaccine has been going on for decades. Okay, we've been studying the possibility of using mRNA in medications and chemotherapy, et cetera, for decades. And so even though it's a new drug on the market, a new type of drug on the market, it's been being studied all along. Okay. And so we weren't starting from scratch. We also had a couple of viruses before this one, the SARS-CoV-1 virus, that gave us a little bit of a head start in fighting this particular virus. The next thing I want you to know is that there are two advisory committees that affect vaccines. One is the Advisory Committee on Immunization and Practices, and that committee is the committee that advises the CDC in the United States on every vaccine that we take. The shingles vaccine, the polio vaccine, every single vaccine that we take, gets an advisory recommendation from this committee. Okay. There's a second advisory committee is the Vaccine and Related Biological Products Committee, and it advises the FDA. So the CDC has an advisory committee, the FDA has an advisory committee. Both of those committees work together to advise for or against any new vaccine. And both of those committees have adopted this vaccine. Okay. So I'm going to say that myth is busted, that we really haven't taken shortcuts with this vaccine in terms of safety or efficacy. Usually in safety trials, the FDA requires 5,000 to 8,000 people to have taken the vaccine. With these particular vaccines, we've had almost 80,000 people in the initial trials. Okay, so if anything, I would say that the initial safety data that we have for this vaccine is far more robust than what we usually have for a drug that comes onto the market. So what about this one? No one knows how long this vaccine is going to last. What do you think about that? We'll talk about the vaccines in general. Most of them, and we have two right now that have emergency use authorization, the Pfizer vaccine and the Moderna vaccine. And those two vaccines involve 2 doses that are taken either 3 or 4 weeks apart from each other. The Pfizer vaccine is 3 weeks apart to the second dose, and the Moderna vaccine is 4 weeks to the second dose. The protection that you get in these studies was 95% in that Pfizer trial and 94% in the Moderna trial within 2 weeks after that second dose. Okay. So in other words, 95% of people were protected against the virus. I'll go ahead and tell you about that 5% of people or 6% of people that did get the virus after the vaccine. They were mostly very mild cases of the virus. No one was seriously ill with the virus after they'd had this vaccine. So even those people who got the virus after taking the vaccine still contracted it. It was a less severe case than we might otherwise see. The vaccination appears to have longer lasting immunity than natural immunity. So what's natural immunity? That is the immunity that your body would build up against the coronavirus if you've had the disease. So if you've been infected with coronavirus, you have some natural immunity. We think that the natural immunity lasts 3 months or so, 90 days, is sort of the point at which we think that it lasts. We have seen several cases of patients who've had the vaccine, before 90 days was up. Some cases shortly after 90 days. Keep in mind that the coronavirus doesn't read any of our data, so it doesn't know when 90 days comes. Furthermore, your protection varies depending on how severe the disease was for you. So if you had a really mild case of disease with very few symptoms, you may not have as much natural immunity as you would if you had a severe case of the disease and your body was fighting that disease for a good period of time. Okay, so there's a good bit of variability there in terms of our natural immunity. So the vaccination immunity appears to be longer than that. The first trials that we were doing with the vaccines were back in July. So that's 6 months ago. And those people have maintained their immunity for at least that long. Okay. We don't know yet how long the vaccine will last, how long the immunity from the vaccine will last, or whether we'll have to have booster doses at, certain periods down the road, or even if we'll have to have a yearly dose of a corona vaccine to maintain immunity. The experts that I have spoken with, their best educated guesses are that we will not, that the vaccine will be one that has sustained immunity, similar to the newer shingles vaccine that was developed against a subunit of the shingles virus. That vaccine is now almost 10 years old, and people are maintaining almost the same level of immunity that they did when they first got the vaccine. our best guess is that that's going to be the case for coronavirus as well, but we'll have to wait and see. So this one's true. We don't really know how long the vaccine protection will last. What we do know is that it lasts longer and is more effective than getting coronavirus itself. Okay. So next statement. I get to stop wearing a mask 2 weeks after taking the second dose of vaccine. So I told you that that you're 95% protected after you've had that second dose and waited a couple of weeks. So can you stop wearing your mask yet? Unfortunately, no. The CDC still recommends wearing masks even after the vaccination. Why? Well, first of all, 95% does not equal 100%, right? So there are those 5%. And keep in mind that real world conditions often aren't quite as good as study conditions when you're looking at efficacy of vaccine. So in the real world, people may not get their second dose, or they may not get it in time. Or there may be other things that affect the efficacy of the vaccine that we don't really know about yet. And so 95% is kind of our best case scenario, but it's still not 100%, right? The other thing is that community transmission of the disease right now is crazy high. It's as high as it's been in the entire pandemic. So when you've got that much disease that's going around and that much likelihood of being exposed to the disease, then you don't want to take that 5% or 8% or 10% or whatever the real world number is that you can still get coronavirus. The other consideration is that you may still be able to get the virus in your body and transmit it to someone else, even if you are immune. Okay. So right now, less than 2% of the US population has had the vaccine so far. That's a pretty small number. And so even though a lot of people have had it, the percentage of people that still are not vaccinated is way too high. The community transmission is way too high for us to back off on wearing those masks. So when will that be? When do we get to stop wearing masks finally? Because if you're like me, you're tired of the masks. What we'll see is that in time, over probably the next 6 months or so, we'll see those community transmission numbers start to drop down. And part of that will depend on how quickly we uptake the vaccine, how many people are willing to take the vaccine as quickly as possible. And when we see those transmission numbers going down, then we'll get some guidance from our health department and from the CDC about when it's relatively safe to move about without masks on our faces again. So busted. Can't stop wearing your mask as soon as you're immune to the vaccine or mostly immune to the vaccine. So what about this one? There is a small chance that you can get the virus from the vaccine. True or not true? Not even a slight chance. Not on a boat, not on a plane, not on a goat, not on a train, not with green eggs and ham. You're not going to get the virus from this vaccine. The vaccine does not have any whole virus in it. It's not made from the virus itself. The vaccine is made up of very small bits of RNA, ribonucleic acid, that are messenger RNA. And those small bits cannot turn into a whole virus, okay? Any more than if I was to grind up a rat and inject it into you, that you would turn into a rat. It's just not possible, okay, for those little parts of mRNA to turn into a virus. What you should know is that when you get the vaccine, you may have some symptoms from the vaccine itself that are similar to COVID-19. It's especially with the second dose of the vaccine, or if you've had the virus, you might have some of these symptoms even with the first dose. A good number of people are having some fever and chills and some flu-like symptoms when they take that second dose of vaccine. That's not a reaction, that is an action that the vaccine is taking, right? That's exactly what we want. Your body is mounting an immune response to what it thinks is a virus, so that later on, if it gets exposed to that virus, you'll have step ahead. Your body will have already had those memory cells and those antibodies that have been made that can very quickly fight off that foreign substance before it takes hold in your body and makes you seriously ill. So those symptoms that you have, the fever and the chills, a lot of people notice fatigue especially after that second dose of vaccine. A good many people will have a headache for a short period of time. Those symptoms are a good thing. Now, does that mean that if you don't have any symptoms at all, you should be worried that you didn't build an immune response? No. From what we can tell, the efficacy of the vaccine is not really related to those symptoms or not symptoms, okay? Some people just mount a more robust immune response. One thing that I can tell you is that older patients are less likely to have those symptoms. So our frail elders, the ones we're pushing to get the vaccine right now, they're less likely to have some of those more severe side effects. We think because as you age, your immune system is just not as robust as it was when you were younger, and so you don't mount the same kind of response. The same way that older patients don't often have fever when they're ill, like other people do. So that's a good thing. The other thing that you should know is that when you get the vaccine, you could already have been infected with the coronavirus and don't know it yet, right? For most people, there's 3 to 4 days after they are infected with the virus that they don't have any symptoms at all. So it's a pre-symptomatic stage. So you could be in that pre-symptomatic stage unless you got a viral test immediately before you got the vaccine. You could be in that pre-symptomatic stage and not know it, and then get the vaccine and then develop the virus. Well, why is that important to know? It's important to know because when you have a reaction to the vaccine, say you have a fever and you start having some symptoms, how do we know whether those symptoms are those few people who already had the virus and then got the vaccine versus those people who are just having the response to the vaccine that we expect? Because if you've got the virus, you need to know that, right? So what we are recommending is that if you have fever that goes up to 100.4 or higher, and certainly if you have respiratory symptoms, if you develop a cough or nasal congestion or runny nose, those would be reasons that I would say, even if you just had the vaccine, that you should go get tested for the virus, because the vaccine doesn't typically cause respiratory symptoms. Although I'll tell you, in my personal experience, when I got my second dose of the Pfizer vaccine, about a day after I had the vaccine, I started developing symptoms. It had been about 30 hours past the vaccine, so nothing at all until about 30 hours. And then that night, before I got ready to go to bed, I started having fever and chills. I even developed a little dry, hacky cough. I had some abdominal pain, a lot of fatigue. I felt generally crummy. I didn't take any medicine for fever because I knew that I needed to know whether or not my temperature was going to go on up to 100.4 or higher. When it did, then I took some ibuprofen and a little bit of Tylenol too, because I knew at that point that I needed to go get tested the next day. So I did. The next morning I woke up, I felt much better. But because I'd had that cough, I'd had a respiratory symptom, and I'd had that fever, I had to go make sure that I didn't have the virus itself. So I went ahead and took that day off from work and isolated. Went to the respiratory clinic at UMC and got my viral test back, and thankfully it was negative, and those were just symptoms of the vaccine. And so I said, "Yay, body! You're fighting off what you need to do." So you should know that you could already have the virus when you take your vaccine. You could get the virus in between those first 2 doses. So just because you've had 1 dose of the vaccine, that doesn't put you up to that 95% protected rate yet. Probably by the end of 2 weeks after that first vaccine, we think that you're around 50% or so protected. So that means that you can still get that virus, and there's a decent chance of you getting that virus if you're walking around with no mask on. You can still get that virus in between those 2 doses, okay? But you're not going to get that virus from the vaccine itself. So that one's busted. Thanks to my husband for helping me put busted on my slides. next one is it is possible that the mRNA in the vaccine could change your DNA. This is something that's really scary, and that really kind of makes people afraid, because am I putting something in my body that could change my DNA? Well, let's talk about that. First of all, you should know that your cells already contain lots of mRNA fragments for various proteins that your body makes. Okay, that's part of your cell's normal activity, is to make certain proteins, and different cells do that differently. Different cells make different proteins, etc. But it works the same way every time. Okay, your body knows what to do with an mRNA fragment. It goes through the cell's little machinery for making proteins, and the ribosome, or the little cell machine, takes that mRNA fragment and makes a very particular protein from that mRNA fragment. The mRNA doesn't go anywhere near the nucleus of the cell. Okay, it does a good amount of social distancing itself from the nucleus of the cell. The nucleus of the cell is off to one part. It stays by itself. Nothing goes into that nucleus, and definitely not a piece of mRNA. It just doesn't do that. So if we're thinking about how this works, DNA directs your cell to make mRNA, which then goes through the ribosome mechanism in the cell and makes proteins. It always goes that direction. It never goes back the other way. And your body knows very well what to do with mRNA when it sees it. Okay, so it goes in one direction. It makes those proteins, and then it stops. Not only that, the mRNA fragments that stay in the cells that they're injected in. So you get this injection, and you have a local reaction to that injection because that mRNA is right there in your arm. And it's those muscle cells that make the proteins, the little spike proteins that are on the coronavirus, that make your body think that it's seeing a coronavirus, and then it mounts an immune response. Okay. Well, so what happens to that mRNA after it gets injected into you? Does it stay in those muscle cells forever? No, it doesn't. In fact, it breaks down rather quickly. That's part of the reason why it's been a little bit difficult to get this vaccine out, because we have to maintain it at way below 0 temperatures so that it doesn't break down just sitting in the vial, right? Because it degrades fairly rapidly, and it certainly does that at body temperature. And so those mRNA fragments, your body breaks them up and they go away pretty quickly. Not only that, your body also breaks up those proteins pretty quickly. What remains then is an immune response, a memory response to what was injected, to those pretend spike proteins. And that memory response stays with you, and that's what makes you immune to the virus. Okay, so is it possible that mRNA could change your DNA? Absolutely not. Next statement: you should get the vaccine even if you've had COVID-19. What do you think about that? Well, we've already talked about how the virus provides some natural immunity for at least 3 months for most people, right? So why do I still need to take the vaccine? Well, we have seen a number of people who've had convincing evidence of reinfection. Now, as you know, that's a difficult thing to determine, or you may not know. It's a difficult thing to determine whether somebody has been reinfected or if they're still testing positive for the virus, because those tests that we use for the virus will test positive even if it's dead virus particles that are in your body. You know, your body might have fought off the virus, but there's still some dead pieces of viral material that your body's continuing to shed for several weeks. And so you might have a positive test way longer than you're actually sick with the virus, and even longer than you're actually contagious with the virus. But we have seen some patients who got the virus, several weeks later were tested, had negative tests, their symptoms were gone. And then even before 3 months was up, they got symptoms again and their test became positive again. So we are assuming that those people were able to be reinfected with the virus. It seems to be more possible with someone who has had a mild case of disease the first time, didn't have many symptoms, and then they have been able to get the vaccine again. And so that goes back to what we were talking about before, that your immunity, the natural immunity, changes based on the severity of disease that you have to some extent. So it's a little bit hard to predict. And again, the vaccination appears to be longer lasting than natural immunity. We covered that pretty well. So why does the CDC recommend waiting 90 days before you take the vaccine after you've had the virus? Well, they only recommend that because you're likely to be immune for at least that long. Could you get the vaccine before 90 days is up? Yes, it is safe. People have done it. Would as a healthcare worker, would I hold off on getting the vaccine because I'd had coronavirus 60 days earlier or even 30 days earlier? No, I wouldn't. I would still go ahead and take the vaccine when it was available to me because it's safe and because I'm in a high risk situation. So certainly if you are someone who is around a frail elder, or you yourself are a high risk person, I wouldn't let having had a case of coronavirus keep me from getting the vaccine. Okay. So that one was true. Here's one that I've heard fairly often as well, that there's microchip nanotechnology in the vaccine that could be used to track you, to track your movements, and that the government could be trying to track where you are based on what they're injecting into your body. Now, I couldn't go through a whole talk without introducing you to my pandemic puppy, who I love very much. This is Nora. Say hello to Nora. She's in the other room. She's being nice and quiet right now. Nora has a chip. We injected a chip into her so that we could find her if she got lost. But we still can't track Nora. The way that chip works is that if someone finds Nora, if she gets out of my house and gets lost, they have to take her to a vet, and then she has to be scanned to see what the information on that chip is. And the information on that chip is just my name and address and phone number. I can't track her with that chip. Nobody can. Okay. Now, would it be possible to put a tracking device into a person? I suppose it could be remotely possible. It would be very expensive. It would certainly be bigger than the chip that we put in Nora, and the chip we put in her was pretty big itself. So if you took say a piece of spaghetti and broke off maybe 3/4 of an inch of that spaghetti, that's about how big the chip is that we injected into Nora. And that chip doesn't have any kind of transmitter where somebody could follow where Nora goes from time to time. So if you added a transmitter to that chip, it'd be even bigger. So that's something that's pretty big if you're talking about actually injecting something that's created by man into your body that we could then track you with. So that's just not possible. We're smart, but we're not that smart. Furthermore, if the government wants to track us, they have a lot easier ways to do that, right? Most of us carry one of these around, don't we? This thing has location services on it, and I could be tracked almost anywhere I go just by carrying my phone around. So I would say that if you're somebody who's really worried about the government tracking you, I'm not sure why you'd be worried about that unless you're doing something shady. And I'm probably not the best expert on shady dealings, but maybe don't carry a cell phone if that's really worrisome to you. But there is no microchip technology that's in this vaccine. So busted. The next one, we don't know the long-term effects of the vaccine. This is an important one. What we know is that side effects of the vaccine and of most vaccines occur within the first 6 weeks. The FDA required 8 weeks of safety testing on this particular vaccine before they'd even let the study continue on, and no serious side effects were found. Furthermore, the most serious side effects from this vaccine that are actually a real risk occur within 30 minutes. And that serious side effect is an anaphylactic allergic type reaction to the vaccine. So what happens if you have anaphylaxis? Your blood pressure drops, you may develop hives, you may have difficulty breathing, you may have closing in your throat. And this is the reason that we don't just give you the vaccine and let you scurry on about your way. We keep you around for at least 15 minutes to watch and make sure that you're not going to have an anaphylactic reaction. So how common is that? Is that something we really need to worry about? The number of people that have had anaphylactic reactions is still in the single digits, I believe. We may have gotten into the double digits out of what is now almost 30 million Americans who've had the vaccine, okay? So your likelihood of having that most serious side effect is probably around the same likelihood of winning the lottery. So if you have anaphylaxis, go buy a lottery ticket that day. It's very, very rare. Furthermore, no one has died because we know how to treat anaphylaxis. It's relatively easy to treat. And the reason that we keep medical personnel around is so that we can treat that if it does happen. Okay. So 0 deaths, 0 have been attributed to the vaccine. Think about how many deaths we know of that have happened due to coronavirus. It's over 400,000. I think I saw the latest estimate would be that by the end of February, 500,000 people in the United States alone will have died from coronavirus. Okay. So if you're balancing out your risks, okay, your risk of serious problem with the vaccine versus your actual risk of dying with coronavirus. That's not just getting coronavirus or being sick with coronavirus or having some of the long-term side effects from coronavirus. Your risk of dying from coronavirus is way, way higher than having any kind of serious side effects from the vaccine. So if you're scared of one of those two things, it makes more sense to be scared of the coronavirus. Another common question that has come up and a common concern is that the vaccine could cause infertility in women of childbearing age. There is no known link between the vaccine and infertility. Out of those 30 million Americans that have now taken the vaccine, lots of them have been women of childbearing age. We've not seen any evidence of infertility. Even in the study trials, the Pfizer trial and the Moderna trial, 12 women in the Pfizer trial and 6 women in the Moderna trial became pregnant after they received the vaccines. It didn't keep them from getting pregnant. Now, what's important about that is that rate of pregnancy was exactly equal to the rate of pregnancy of those women in those trials who got placebo, who didn't get the vaccine but got a sham vaccine. So if you're looking at the data that we have, even in those initial trials, and those two trials together included about 80,000 people, no evidence that there's been any change in infertility, okay? Furthermore, women are still getting pregnant even after they've had coronavirus. We've not seen a lot of people who've had trouble getting pregnant after having the virus itself. And so there's just really no reason to suspect that this vaccine could cause infertility. So where did that come from? It was a social media rumor, okay? And that brings me to another point that I want to make, and that is think about where you're getting your information, okay? Fear travels quickly, and so fear stories travel quickly across social media. Not only that, but even in the news, you see things. There's, there are things that show up that frighten people, and then that fear motivates you, right? So I have a 23-year-old adult daughter who's highly educated. She's not in the healthcare field, but she's healthcare educated. She's lived with a doctor all of her life. She heard about a question about, well, could people be getting Bell's palsy from this virus? And so when I asked her about taking the taking the vaccine, she said, well, what about this Bell's palsy thing? That scares me. I don't like the chance of Bell's palsy. And I said to her, when they actually looked at the incidence of Bell's palsy in people who'd had the vaccine and people who had the placebo, the same number of people who had the placebo got Bell's palsy. So Bell's palsy is something that's common that happens to people, whether or not they get a vaccine. And so again, there's no evidence that a long-term side effect has occurred with this vaccine. Okay. So that one's busted. I think that I'm going to stop there. Before I talk a little bit about tips for caregivers, I'm going to stop there and look at, actually, I'm going to ask Kathy, have you looked in the chat? Are there questions in the chat that I need to answer, Kathy?
Yes, there are a couple of questions. When you were speaking about the reactions to the second vaccine, the second dose of the vaccine, you mentioned the possibility of fever.
Yes.
And the question came up was, should you take medicine for fever prior to getting the vaccine or not? You know, typically people will take a Tylenol or an ibuprofen or something like that before they go get the vaccine to help it not, you know, hurt as bad, if you will, or whatever, just to ease those symptoms. What are your thoughts on whether or not they should take some type of medication before getting the vaccine?
So I'll start by saying that you'll get a different answer depending on who you ask as far as this goes. But let me give you my thinking and my rationale behind what I did. One thing is that I'm a geriatrician. I'm around a lot of very high risk people in my job. And so it is extremely important to me that I know if I have coronavirus the minute I have symptoms from it. So that's part of the reason that I held off and said, I'm going to wait. I'm going to wait and see how high this fever actually goes so that I know whether or not I should actually be tested for the virus. If you're going to be on the safe side, certainly if you're around any high risk people, I would take that approach. If I were you, I would not pre-medicate. Because you want to see what's going to happen to your body and whether or not that could be symptoms that you needed to then go get tested for the coronavirus. If I lived in a hut by myself, wasn't around anybody, wasn't really at risk for exposing anybody else to the virus, then yes, I might go ahead and take some medication beforehand. And you may hear some doctors who recommend going ahead and taking medication. You know, some doctors I've heard recommend and say, well, once your symptoms after your vaccine happen, if they last longer than 24 hours, then you should go get a corona test. So there are a little bit differing opinions to that question. My personal opinion is if your fever goes up above 100.4, certainly if you have respiratory symptoms, you need to go get tested regardless. Now, Tylenol and ibuprofen aren't going to affect whether or not you have respiratory symptoms. So the only concern there is that they would dampen that fever response, and you might not know that you were having a fever response.
One of the other questions in that same section, could chest pressure as a be a post-vaccine symptom, or is that something that needs to have greater attention?
Chest pressure always needs to have greater attention. You shouldn't really have pressure in your chest. If you do, that would be something that you would want to call and talk to a doctor about. If it's something that's significant, if you're having significant heaviness that's associated with shortness of breath, that's a 911 call always, regardless of where and when you took the vaccine.
Okay, another question. What's the racial makeup of the trials? There's been some talk about prior vaccines and the differences of effectiveness among different races and different ethnicities.
A very good question, and I'm going from my memory here, but like a lot of trials, Black Americans were underrepresented in those trials. I think there were somewhere around 8%. And then if you included Hispanic Americans, that number went up to somewhere around 15% or so. And those numbers may not be accurate. That's going from memory. But what's not from memory is that Black Americans were underrepresented in those trials, like they are in most trials that we do. Okay. And what we're seeing in Mississippi is that the percentage of people that are taking the vaccine so far, about 69% of the people who've taken the vaccine in Mississippi are white. And only about 17% of the people who've taken the vaccine in Mississippi are Black Americans. That's concerning because our population is about 37, 38% Black in Mississippi. So there's a big disparity there. And it's an understandable disparity, that question about were Black people represented in those trials, that's a good question that you have to ask. And the reluctance to take the vaccine or to be trusting of healthcare providers or research in general is there, and it's understandable. So that's a difficult question, and I think one that explains why people like Sharon, the long-term care provider that we listened to initially, was pretty reluctant to take that vaccine. And so I would say that we all should sort of take the approach that she did, that it's not really my job to convince anybody to take this vaccine. What I want to do is give the best information that I have so that people can make the best choice that they can make. Black Americans are overrepresented in terms of who's dying from this disease. Okay. Almost 3 to 1. 3 Black Americans die to 1 white American. So it really concerns me that the vaccine uptake is in the other direction. So if you are someone who is Black and who has influence and is willing to take the vaccine, I would hope and ask that you would be one of those ambassadors, one of those people who is willing then to say to your friends, family, who trust you, hey, even though we're not as well represented in these studies, we're dying more. We're dying much more from this disease. And so the risk to benefit ratio there is even more in favor of the vaccine. Okay, good question and a hard one to answer.
We have time, and we've got about 5 minutes left. So very quickly, there are 2 questions. One, once you're fully vaccinated, if you are exposed, do you still need to quarantine if you don't have symptoms?
Okay.
The others on a different level. So I'll let you answer that one first. And then
okay. So yes, as of right now, as long as community transmission is as high as it is, our other behaviors around the virus don't need to change. We still have to quarantine. If we have symptoms, we still have to isolate and get tested. Because again, there are those 5, maybe a little bit higher than 5% in the real world, not a study, that can still get the virus and can still transmit the virus to other people. So we still have to keep acting the same way, even though we're likely protected. And we'll need to keep doing that until we see those community transmission numbers go way down from where they are right now.
would you recommend someone that has shrimp allergies to take the vaccine or not?
So and I'll apply that question to a lot of other questions that I've gotten that are similar. I have an allergy to penicillin, or I have an allergy to this drug or that drug. I would not let an allergy to anything else stop me from getting this vaccine. The people that I would say need to talk to an allergist or an immunologist, and maybe even take the vaccine under close watch, would be people who've had anaphylactic reactions to multiple injectable medicines. Okay. Lots of people are allergic to antibiotics, for example. There's no antibiotics in this vaccine. There's no egg products in this vaccine. Some people are allergic to egg products and so can't take vaccines with egg products. There are no preservatives in this vaccine. That's why we have to keep it so cold. Okay. So there's no preservatives that you're going to react to. So it's not, and mRNA is not generally something that you would react to either, right? Those ribonucleic acids are all over your body already. So there is a very small chance that the carrier the lipid particle that we surround the mRNA with, which is polyethylene glycol, and you might have heard that word before if you take Miralax, right? That's the same thing. There could be some people who are allergic to that lipid, but that's why it's so rare that we see an allergic response to this vaccine. So no, I wouldn't let a shrimp allergy keep me from taking the vaccine. Only if you've had multiple reactions to other injectables, especially other vaccines.
We could continue for hours. Thank you, Tarver. We really appreciate your information and pulling all of this together. I wanted to ask you, do you have a few minutes for those who would like to stay on to talk about the tips for caregivers?
Glad to.
Before you go into that, I do have this question's come up a couple of times in our chat, and I want you to address this first.
Okay.
You had stated that you took the Pfizer vaccine. Is there any preference for Pfizer over Moderna? And then what about the efficacy that we're seeing, the difference in the efficacy rates in the new Johnson & Johnson vaccine? Can you speak to any of that?
I haven't looked closely at the new Johnson & Johnson vaccine, so I can't give you a good answer to that question. It's not available to us yet. And my personal opinion is take whatever's available to you. Okay. The difference in efficacy that we're seeing, the 94% in that Moderna trial, 95% in that Pfizer trial, that's not a significant number. 1% difference in between those two, you could have that much error in the trial, right? So there's not a significant difference between those two drugs. So I don't have any preference. I would say whichever one you can get first. And I think I would maintain the same statement about the Johnson & Johnson vaccine as well. Some people are saying, I want to wait until they come out with a vaccine that only has one dose and I don't have to take two. My advice is don't wait for anything. If you're somebody who has access and can get the vaccine, go ahead and take it.
Thank you. And I think there was a news report this morning that mentioned there was about 86% efficacy on the Johnson & Johnson vaccine. So
and that is a significant difference between 86 and 95% is a significant difference. So thank you. If you need to jump off, I understand, but I'll stick around and give these few other tips for caregivers who are taking care of people with dementia, or maybe who know caregivers. Some things that we need to think about when as we're still in this pandemic. If you are jumping off, thanks for listening in. So, how do we maintain a level of function in our elders during this time? Everybody, myself included, is sitting more. I'm doing mostly telehealth, or I have done mostly telehealth for the past year. And my watch will tell me that the average number of steps I've taken this year is abysmal compared to what it was last year, because we've been so sedentary. So with our elders, that's an even bigger problem, because if you sit still when you're old and frail, you lose it. Right? You lose the ability or it takes a whole lot longer to build back that function. So we want to really work to maintain functional mobility in our elders. So get them outdoors as much as possible, get them exercising, keep them moving as much as you possibly can. Practice indoor exercises. The things that you do from day to day are some of the best exercises that you can do. So in other words, a lot of people fall when they go from sitting to standing because those muscles in their thighs get weak. So practice some sit to stand exercises. Get them to sit and then stand and sit and then stand. If they use a walker, keep that walker in front of them and have them still do sit to stand exercises and keep those muscles in the legs strong. Tai Chi is another, is a type of exercise that is good for elders because it doesn't involve a whole lot of stretching or jumping or things like that. It's a balancing type exercises. And it's been shown to actually be superior to some of the other exercises that we do in terms of maintaining strength and balance for elders. Get your elders dancing. If it's someone who has enough dementia that they can't really follow instructions all that well, turn on some music and get up and dance and see if they'll dance with you. Any way that you can get folks moving is a good idea. Get creative. Ask your support system for other ideas, because people around you may have things that you haven't thought of that to help get somebody moving who tends to stay still and sit in a chair and watch TV. Get your elders out and move them about. The virus is not just floating out there in the air, right? It's carried in respiratory droplets. So that's why masks work, even though the virus is smaller than the fibers that make up those masks. The virus is carried in respiratory droplets that don't get through those fibers in the mask. So it's safe to go out for a drive. It's safe to go for a picnic that's where you're still socially distanced from people. And I think getting our elders moving, getting them out and about, and keeping them as connected as we can is what we need to do. So that may mean assist them with virtual connections to family and friends, right? My parents would need assistance getting on a Zoom meeting because they've just not done it. They would need, probably my son to come help them get hooked up. A lot of my patients that I do telehealth with, I have to kind of talk through how to use FaceTime the first time we do it. And so assist those elders in keeping connected, keeping virtually connected. I think seeing people's face when you're sitting at home as opposed to talking on the phone is not as good as seeing them in person, but it's better than just listening. Especially for an elder with dementia, the more of their senses that we can involve in connecting them with other people, the better, the more connected they'll actually stay. So getting them a video connection with their grandchildren, or if they're in a long-term care facility, asking if there's someone in the facility who can get an iPad in their room and connect them. There's been lots of creative ways to connect that have been very helpful to our elders. And then find specific ways that other people can contribute. So for example, say your loved one is in a long-term care setting. Find someone in that home who's willing to help you get connected to them, who would maybe even use their own phone and let you FaceTime with your loved one. Okay. Maintain their level of function and their connection as best you can. And then finally, taking calculated risks that support what is most important is not unreasonable. Okay. And what I mean by that is, if your loved one is so isolated that they're in danger of really becoming depressed, not eating, they're really starting to decline, then that's probably worth some risk. Okay. Now calculate that risk. Don't bring all your teenagers who've been running around out in the world doing who knows what. But if you've been very careful and you're wearing your mask consistently and you can come up with a way to visit them, then absolutely take the risk that you need to for what's most important to that elder, right? If they would rather die than not see their loved ones, then find a way for them to see their loved ones as best you can. Okay. Now, some of that may be limited by the rules of the facility itself if they're in a facility. But I do think that thinking about what's most important to that person and thinking about how to make the risk as small as possible. And that may mean you get the vaccine, right? To lessen that risk so that you can then visit with them and attend to those things that are most important to them. So what about those folks who are in long-term care settings? What can we do to help them? Communicate often with the facility about what their procedures are. So you can actually affect the long-term care facility because they're in the midst of a pandemic just like everybody else is, only they're more involved. Every facility in the state of Mississippi, I don't think there's one left that has not at some point had an outbreak. And so they're in the thick of this, and they may not be as creative as you are in terms of trying to figure out ways that you can stay connected to your loved ones. So communicate with them about what their procedures are. Find ways that you can actually help to see if you can help them be creative about keeping their residents connected with folks. Make sure that your emergency contact information is correct with the facility. A lot of times a loved one was admitted 10 years ago and you may have moved or may have a new phone number and forgotten to update your emergency contact information. So make sure that that's correct. And then ask the facility, how can you contact your family member? By phone, by video chat, email? Can you send letters? Find ways to connect them as much as possible. If your loved one cannot communicate, then ask the facility how you can get updates. So if it's someone who can't talk, I would want to find somebody in the facility who's familiar with your loved one and communicate fairly often with them about how that loved one is doing and what ways you can reach out and have some interaction with them. And then discuss or even provide written information regarding wishes in the event of COVID-19. So if your elder is late stage dementia and you don't necessarily want them to go to the hospital if they get sick with coronavirus, that's something that needs to be communicated, and an order needs to be written in that patient's chart that they're not to be hospitalized, and that if they were to become sick with this virus, that you only want comfort care. And that comfort care can be provided in the long-term care setting. That patient does not have to go to the hospital. If it's somebody who just has very little quality of life and you know good and well they wouldn't want to be moved out of their facility where they know everybody around them into a hospital setting where they're going to be isolated in a room and know no one around them, that's certainly understandable. Just make sure that the facility knows that and has the orders on their chart that are necessary for that. How can we support people who we know are caregivers at this time? Because they're having a hard time too, right? Ask for ways that you might ease their burden or give them some respite, okay? Ask them if you can come for an afternoon and stay with their loved one for them, just to let them get out and do something, get away from their caregiving responsibilities. They may need some ideas about how you can help. They may be in sort of survival mode and things have gotten really difficult, and so they have tunnel vision. So help them be creative about things that you might be able to do that would help them, okay? And then listen carefully for any subtle asks that they may give you, okay? Because it's so common for caregivers to feel like the burden is theirs and they have to bear it, and they don't want to pass that burden on to anyone else that they love. And what people often forget is that the burden is not nearly so heavy for those of us who aren't living with it on a day-to-day basis. And so the things that we can give and can do to help are not nearly so burdensome as that caregiver may imagine them to be. So listen really carefully to the things that they say. And if you hear a stress that they're experiencing that you might get help with, put that out there, and ask them very specifically, can I do this for you? Is there, can I do, a particular thing for you? And then respect their responses. So if they say no, then be respectful of that, but don't go away for good. They may change their mind somewhere down the road. So ask often. And ask specifically, can I do this? Can I do that? Okay. Encourage and help them to care for themselves. Ask them, have you been to your doctor? I can't tell you how many caregivers I've talked to this year who have let their own health care go. They've not been to see their doctor. They've not gotten their medicines refilled. They haven't checked their blood pressure in a year because they're taking care of mom. So encourage caregivers to take care of their own healthcare needs. Okay. And then offer to talk through difficult end-of-life decisions that they may be having. Those things are difficult to talk about with other people. We feel a lot of fear and shame, and we, say that caregiver is trying to make a decision about, well, my loved one has the virus. I really don't think they would want me to, to take them to the hospital. They may need somebody else to say, you know what, that's a okay decision to make. It's really okay to make the right decision for your loved one. Make the decision that they would want you to make for them. You don't have to feel guilty about deciding that you're going to focus on the comfort of that loved one and not put them in the hospital in a situation where they're going to be extremely isolated. So bring up those hard conversations. Say, what are you thinking? What will you do if your mom gets the disease? Have you thought about that? Do you want to talk about it? Offer to talk and have some of those hard conversations with them. They may be desperate to have those conversations with you. And then call or visit as safely as you can, as often as you can. Those caregivers need connection too. They will go downhill very quickly if they become isolated. And so try to make sure that doesn't happen. And that's all the tips I had. All I can think of to say. How far have we gone? We're 12 minutes past. So,
and so in those last 3 minutes, I have one last question.
okay.
And this is pretty pertinent. What suggestions do you have for families who are trying to get their loved ones vaccinated, but are having difficulty setting up an appointment, especially in rural areas? Is there any solution there?
So be persistent. You know, one of the difficulties that we're seeing is that even the health department doesn't know when they're going to get another shipment of vaccine. And so because of that, the clinics that are providing that vaccine, or the sites that are getting that vaccine doled out to them, they don't know when they're going to get more. And it may be today, it may be tomorrow, maybe the next day. And they just, so on a day-to-day basis, we really don't know what's going to happen. And so you have to check that website often. Okay. That covidvaccine.umc.edu. Check that often. Check it in the middle of the night. Check it early in the morning, because when a bunch of new appointments open up, they go within a couple of hours, they're gone. Okay. And so checking often, checking at weird times of the day is a good way to do that. The other thing that I would say is let your doctor know that you're having trouble, because sometimes we as physicians know things in advance. For example, at UMC, there was a period of time where our clinic at UMC was able to give the vaccine a couple days before it went live on the website. And so those patients that I knew were really, really eager to get it, I was sending them notices, by phone. Hey, we can get you signed up. Call the office right now and let's get you signed up. So check with your doctor if you're having difficulty. The other thing to do is check with local pharmacies, because some of the local pharmacies are going to get doses of the vaccines sometime soon, and they may have sign-up lists or that kind of thing. So check with local pharmacies, places that aren't going through the health department, because they may get some doses of the vaccine that are a little bit easier to get to as well. So, but be persistent. Find somebody in your life who's on their computer all the time, who wouldn't mind constantly checking that site for you. If you're somewhere where you don't have computer access, or your personal access is slow, and sign up for, get somebody who's not slow, who can sign you up as quickly as they can find those appointments.
Dr. Tarver.
Mm-hmm.
I'm Ann Keenan, and I live in Jackson. I'm a widow. I'm 75. I live alone. And two of the most rewarding things I have done during this time, I have found first vaccines for 6 of my elderly friends.
Beautiful.
I'm once a teacher, always a teacher.
Beautiful.
We get up way before daybreak, and at 5:30 or 6 every morning, I will get on but I call and get all their information, the last 4 of the social and all the mother's maiden, all the essentials. And they are so excited when I call them to tell them. And I said, now, as soon as you get your first one, call me that afternoon and I will help you get your second one. The second's been easier to find.
Right.
But I also have 2 friends who got their second shot yesterday, and they don't feel so great today. They've had all kinds of issues. Thank goodness they're starting to dissipate. Yeah. But I am cooking 1 day a week for my friends who have had their second one. They don't feel well, and I have had to get up twice and stir this big pot of vegetable soup I've been simmering all day. And so I'm trying to take dinner to my older friends who are experiencing the after effects of that second shot. And it has made me feel so great that I can do that. And I get my second one Tuesday, and I'm a little apprehensive, but I will be there to get it. The National Guard has done a great job.
Yes, they have.
Yes.
And thank you for sharing a great example of how we can help those people around us.
It doesn't take much.
That's right. You need the last 4 numbers of the Social Security number, their date of birth, and their mother's maiden name,
the county they were born in, basic things. But I keep a little pad by my computer, and I just found another friend that I had not seen in 50 years that I grew up with, and she's alone as well. And she said, I can't find a shot anywhere. So she's my next project.
Beautiful. I have my sister to thank for doing that in my family. She made sure that both my parents got on a list, and then my brother got on a list.
I found my
and just
sisters,
kind of
both of her
stayed
shots
after
as
it.
well. Absolutely.
Thank you for
Well,
sharing
thank
that.
you for everything you're doing. And thank you for answering all those questions.
Sure, I'm happy to answer more for a minute longer if there's another one.
I've got to run tutor. Thank you.
We also mentioned in the chat that we have recorded this presentation. If you are interested in receiving a recording of the presentation or a PDF copy of the slides, if you'll email us at mindcenter@umc.edu, and that is in the chat, mindcenter@umc.edu, we will forward that to you. So there aren't any further questions. Dr. Tarver, thank you so much for sharing such wonderful, pertinent, understandable information with us.
Good, thank you.
For your effort to prepare and share that information with us. And then I want to encourage our attendees to join us again in April. Our next presentation will be scheduled in April, and we'll be sending more information about that soon through all of our networks. So thank you so much. We hope you have a wonderful afternoon. Stay safe, mask up, and vaccinate if at all possible.